Good morning, everyone out there in webinar land. Thank you for joining us today. My name is Julia, and I am a lived experience educator with Insight. It's a pleasure to welcome you to today's third Insight APSAD webinar for semester 2, 2025. Before I introduce our speaker today, I would like to acknowledge the traditional owners of the land on which we're gathered. These are the lands of the Yagara and Turrbal peoples in Meanjin, otherwise known as Brisbane, and also to all of the lands on which you are joining us from today. I would also like to pay my respects to elders past, present, and emerging. I'd like to recognise the role of my fellow lived and living experience workers in our sector and their journey, along with carers, families, and others, as they respond with care and empathy to people experiencing problematic AOD issues. Today, we have a colleague of mine who I admire and respect deeply, psychologist and Insight Program Manager James Hoey, who will be talking about one of my favourite subjects, motivational interviewing. James will be exploring the idea that MI isn't something that is done after assessment or once trust is built, but rather how MI lends itself to the early stages of engagement, particularly during initial AOD assessment. As per usual, you can type your questions and messages in the chat and we will look at them and we'll either answer them as we go or at the end. And now it is my absolute pleasure to hand the reins over to James.
Thank you very much, Julia, for that very warm welcome. And thank you, everybody who's come along and joined in this morning to our session. I hope the next 60 minutes or so that we share together is helpful and useful. And as Julia just mentioned, kind of talking about that wonderful role that MI can play, motivational interviewing can play as a really great companion to a lot of things that we already do. Before I move on, though, I think particularly in this area of, as you mentioned, Julia, just then, the importance of understanding, issues associated with problematic alcohol and other drug use, and hopefully today's a little bit about there might be some things where we can do things better. It's just to remember that this week, Sunday is the official day. It's International Overdose Awareness Day. And I think that's always important for us to remember, particularly when we consider since 2008, the number of intentional and unintentional overdoses has exceeded the Australian road toll. It's getting up almost near double. It's just under that now. And we often don't get loud about this as much as we should. And that's one of the themes of this year's Overdose Awareness Day, is to get loud. So just wanted to acknowledge that. So look, as we go through this morning, I wanted to share a little bit with you about the inspiration for today's session. There's a number of vectors. Just a little bit of behind the curtain stuff. When anyone comes and joins here, to become part of Insight, one of the very first tasks is to get your photo taken and to write a bio to go up on the website. Some of you might have seen that, just so that people have an ability to kind of meet the team. Now, when I first came on board, coming up 6 years ago, I was reading everyone else's bio for a bit of inspiration as to what to write, and I suddenly realized that I'd kind of like joined the cool kids group, and I was going to get found out because that is not me at all, because I was reading these wonderful bios about the work that people had done, as well as also a nice little factoid about them. And, this is a group of people that hike mountains and can cook cakes in teacups and do art and craft and, develop board games and all these sorts of things. And about the only thing I could come up with was pretty much, I like sitting on my tractor, when I'm not at work. So, but the reason why I guess I'm talking about that is because what I did write a little bit about my kind of professional motivations and professional experience was what you're seeing on the screen there. That this has really been an interest for me for quite a long period of time, is how do we really make sure that the front door of our services is one that is open wide and left open wide at all stages, and that we keep that in mind. And I guess that's one of the drivers a little bit about putting a few things together this morning to talk to you about how we might be able to do that. The second part of the inspiration occurred only in this year. Back in May, I was really privileged to attend with a whole group of some very good humans, the Motivational Interviewing Network of Trainers Oceania branch, their forum that was held down in Melbourne. And Minto, as it's kind of known locally, that's a group of trainers and friends of Minto who are really interested in MI and formed these groups to, or this particular body, to be able to connect and support each other in the practice and the research and the training of MI. This group, Minto in particular, covers Australia, New Zealand, and some of the South Pacific Islands. I went to that forum, and the whole focus of that was about the integration of motivational interviewing as a companion to the things that we already do. And the very first presentation that occurred on the first day of that forum was by Dr. Sonia Zammit, who's a clinical psychologist based down in Victoria, who was really talking about her work in psychedelic assisted therapy. And quite an amazing presentation from somebody giving their personal reflections on that, but really bringing in how does kind of MI help those processes, whether it be about the preparation phase of psychedelic assisted therapy, whether it be actually about the psychedelic components of where those elements where people are using the substances to be able to kind of have those immersion experiences, and then the integration, how MI can help all of those stages. I just wanted to shout out to Sonia, who's given me permission to kind of share that. That was a real inspiration for me to start to think about how do we integrate that with this kind of drive and passion I have for making sure our front door is good. How do we bring those two things together so that we know motivational interviewing helps us to do things that we're already doing? How do we do it at the front door is where that all came from. So that's a bit of a long story to tell you how we kind of, well, I got to today, and I hope there's some value in this for you as well. So a bit of a roadmap. What I'd like to talk about today is, well, why is it that, MI can be a good companion to us? I think probably I'm preaching to people who already know that in many ways, but particularly in assessment. As well as also, where are we at with our initial assessment kind of processes at the moment? What's the research telling us about some of the standard and the general ways that we do it? And then lastly, what I'd like to kind of talk about then is, well, what does MI bring? How then can we bring it to our front door in our AOD services? So, and specifically, they're talking about the fact that for many of you who are experienced and know motivational interviewing, there's two components to that, the relational and the technical skills, and both of those are essential. Certainly not time this morning in 55 minutes or so to go through and a full exposition or a training or a skills practice or any of those sorts of things in relation to what is motivational interviewing. But I'm just popping up there the fourth edition of the founders' text, Bill Miller and Stephen Rolnick, what they say motivational interviewing is about. And they don't call it a therapy. It's more of a way of organizing a conversation and having a conversation with people that helps people to really kind of connect and build that relationship with that side of them that maybe desires something to be different and change and to grow and to change. So basically, in that way, it kind of brings a lot of opportunity for us in our AOD work, given that we're often meeting people in a situation where change is something that they're looking for. And there's this nice little saying, I think I'd heard it before, but I certainly heard it at the Minto Forum a lot in May. Really motivational interviewing is a companion. It helps us do so many of the things that we already do. and in many cases makes those things effective. So just in general, talking about, well, what has motivational interviewing brought to our AOD work? And, this goes back to, I think Bill Miller first started talking about motivational interviewing or presenting it in a kind of a coherent format, probably in the early 80s. For those of you who've been around in the sector, you may remember that. I kind of remember it coming in some ways. What's it brought? Well, one of the things it's really brought to our work, and then later on I'll talk about, well, where we bring that into this kind of front door element of our service, is, MI really brought this idea that dependence is not about moral weakness. And I'm going back, a couple of decades here, although sometimes these things still do pop up today. It's not about moral weakness. It's not about weak character. It's not about kind of, this deficit focus. It's a real acknowledgement, and what MI kind of brings is that there's this kind of conflict that occurs between competing reinforcers. The people that we work with, part of them will value some element of the substance use. That's kind of been the learned experience. And then often there's another part that worries about some other element of it. And that MI really allows us to kind of meet that two-mindedness, that kind of position that people come in, and it's kind of their job to be ambivalent in many ways, as we talk about here in our trainings, to meet that without judgment. Also, what MI brought, in contrast to some of the older or previous models, whatever the best way to put that, is that MI respected that people could be at different stages of readiness. A lot of previous treatment approaches were very kind of like readiness required was almost kind of like a sign hanging out in front of them, or as workers, we were becoming readiness gatekeepers about, who's appropriate and who's ready to be able to do that. Whereas MI kind of says, well, where a person's at, we also know that it can help build that kind of readiness, going back to the original definition, strengthen a person's own reasons and own commitment to change. MI helps to kind of build that, and therefore we don't have to wait for people to kind of cross a line before it is that things can be put in place to support them. Also, it mainstreams MI, a whole transdiagnostic skill set. MI, if you look at the research, is being used in a lot of kind of health areas, health behaviours. You don't have to be a specialist, and you also don't have to be like, the most perfect. And I learned this had this reinforced at the MI forum down in May this year, is that, sometimes a little bit of MI, it's all kind of, even if you're not fully kind of immersed in it or understand it, there's elements that we can use that can still be effective. And also just another element that it really kind of recognizes what is so strong in the research these days, also strong in culturally responsiveness as well, is that engagement first, relationship first, is actually so essential to good work, effective work, and in many cases, retention and those types of things. And for services feeling culturally safe for people. So I did a little bit of not a very deep dive, because there's like 1,000 RCT trials and everything like that around the world with motivational interviewing. I just pulled out a few, and we're not going to kind of go through that. That is an awfully kind of ugly slide in a way. But you just really want to kind of represent that MI has been helping us as a companion and as an integrated companion for so long, and in many different ways, and kind of proven its worth in terms of strengthening a number of things, often used with things like CBT, also used with things like ACT, contingency management, lots of different stepped pharmacotherapy management, digital kind of interventions. Very consistently, that companion, that bringing in MI alongside, has shown to improve engagement, in many cases kind of reduce distress and issues, as well as also enhance a lot of those kind of, I guess, downstream outcomes, things like attendance, criminal justice involvement, and those types of things. Depending on the strength of the companion, so something like CBT, which has kind of a strong effect in and of itself, along with some of the other types of kind of cognitive and behavioural therapies that exist. Where MI really shows its value is that it supports things like, again, attendance, retention, and engagement, beyond just what the actual kind of single therapy approach does. So a lot of research, and some of the key drivers that really recognize what are the contributors or the mechanisms, because again, not enough time to kind of go in depth into a lot of these things. Some of you will know this language in many ways. MI really brings this idea of understanding the language of change, and that MI consistent skills can increase the amount of change talk from a person, as well as also has that kind of effect of being able to soften sustained talk, which is the other side of change. And that the differential between those two is what kind of predicts behavior change. So that's one of the key mechanisms. Another mechanism is that it has kind of inbuilt through things like the relational skills and the spirit of MI, which I'll speak about in a moment. It has this kind of way of being able to rapidly support the development of alliance and empathy. And it also supports autonomy. Therefore, there's less likelihood to be kind of that unconscious psychological reactance, because it works in a way that minimizes the risks of people perceiving that there's some sort of threat to their choice or freedom or autonomy in many ways. Even if it's unintended, sometimes some approaches can do that. As well as also, it really kind of focuses on evoking what matters. It's the client's very much the consultant in MI approaches in terms of collaborating and sharing power and those types of things. So I'm going to kind of do something a little bit interesting here now that we start to talk about this idea of maybe kind of the companion of MI in relation to things like assessment. I wanted to get a bit of an idea, because I've looked at the Australian prevalence data and I'll share that with you in a few moments' time. But I'd love to get a bit of a picture around what it is that people out there, what you're experiencing. So hopefully I've launched a bit of a poll on the screen there, asking this question, because I'd love to kind of survey the audience to find out a little bit about what's it like in your neck of the woods, and where people are finding that there's kind of this highest proportion of dropout from their services. I'll give it another few moments. We've got a lot of people kind of jumping in there. Thank you. I'll end that poll now just in the interests of time. We've had some really good responses, and I'll just share the results there. Yeah, really kind of equal kind of running there, you know, a distribution across all of those three options that I gave you. Kind of slightly nudging ahead there, a little bit around about sort of the 40% of people are saying it's kind of after that first appointment or intake. Now, that's not necessarily a bad thing. If we started moving into, and I won't turn this webinar into a kind of a reflection on single session thinking, which is, it's you know, a really amazing kind of approach to the work that we do as well. But sometimes single session can be quite, you know, okay for people. But often a lot of the times what's kind of happening is we're seeing people in that kind of maybe vulnerable stage, and then there's this kind of drop off that occurs, which is not always necessarily good for the way that we run our services, or necessarily good for people themselves. So here's my second question. What proportion of the people that you work with don't usually return after the first appointment? It's a similar type question, but I'm just going to launch that poll. Hopefully that's come up on the screen for you as well. If it hasn't, Julia will let me know. Okay, I'll let a few more people vote. Just wanting to get a real kind of sense of context about if what I'm seeing in the prevalence data and what I'm hearing anecdotally and talking to today is kind of supported out there. Yeah, okay, great. We've got a few votes in, so I'll just share the results. Yeah, so look, kind of estimates there between that kind of 10 to 30%. And higher in some. I was talking to a very experienced medical officer yesterday from one of our metropolitan clinics in the southeast region, and they were saying kind of like about 45%. Seeing that represented here as well, that there's quite a high proportion of people that we're seeing don't necessarily return after that first appointment. Again, that might have been the intention. Single session can sometimes be sufficient for a lot of people, a lot of evidence to support that, but a lot of the times that's not the plan. So how do we kind of improve that, I guess, is what we're looking at. Just for your interest, and the national data, we've actually gotten better over the last 10 years, where, and this is national, so it may not reflect what occurs for you in your area. You might be higher or lower, but taken as a whole across Australia, used to be about 40% 10 years ago of people that didn't sort of return after that kind of one appointment. It's down to about 20%, but that's still 1 in 5 on the most recent data from 2023. I don't know if that's a surprise to anyone. So where are we at with, that's kind of, we're seeing that. So is that ideal or not? Most kind of research would say that possibly it's not amazing. And rather than it necessarily always being about the client, are there things that we can do? Well, interestingly enough, as I started to explore this topic and got kind of interested in thinking through all these kind of inspirations around me about how we might bring in this companion of MI, if it does help us, and we see that through the research, what's actually happening out there at the moment in relation to AOD, and some of the research here is also co-occurring mental health intake and assessment processes. Well, that little kind of list along the bottom there that you're seeing of the different studies have all occurred within the last couple of years. And in fact, that Patel study out of the UK is quite a huge one. It's kind of like systemic review, so a level 1 analysis of about just under 40 studies from around the world, and looking at about 10,000 plus records. But what did they find? Well, they kind of found that it's not coming out amazing in relation to what people are finding qualitatively, in particular around how assessment is being done in services kind of worldwide. It's not just a kind of a local thing. One of those studies, though, was actually done in Victoria, the VADA one there. They commissioned the people from the University of New South Wales to kind of look at the Victorian system. And very strongly, what kind of came out from that was a number of key themes, really looking at the fact that things like centralized intake, phone-based intake, and I'm not trying to burn any houses down here, but those sorts of things are, presenting actual kind of more opaque type barriers. And then what is it then are the recommendations, or what is it from the qualitative research in particular that people are looking for? And as we kind of see there, it's about wanting to have that kind of humanizing encounter, wanting to be able to have clear information, and engagement first is what's really key. Okay, so moving on from that, and I don't know about anyone who's out there in webinar land today, but when I first came into working in public health, we had the thing called the 16-page ATODS IS assessment. I don't know if anyone remembers that, but that probably fits pretty strongly over on the left there. I hope I'm not kind of re-traumatizing anyone with memories around that one, but it's kind of one of those things that we tend to have, often for good reason. It's kind of like standardized assessment approaches needing to kind of collect data, but let's keep going on this topic and see where we end. So then what I wanted to look at, well, does MI actually help us with initial assessment? Is there kind of evidence for that, or is it just this idea in my mind? We know that it helps in AOD treatment. Does it help at that kind of front door? And again, just pick the eyes out of a couple of studies that really, really I guess, reinforce the idea, again, around MI in collaboration or in integration with that kind of step in the treatment engagement journey, results in a lot of kind of downstream outcomes around things like retention, engagement, sometimes the impacts on substance use as well. And what were the mechanisms that the researchers really kind of identified as to why MI helps at that kind of stage of the process? Again, because of the way that MI works to, kind of maintain that acceptance of ambivalence, that kind of non-judgmental, curious stance. Generally, things were less likely to cause reactance in people, even that kind of unconscious reaction to things. That resulted in kind of less risk of discord. And discord is about, I don't like you, or I don't like the service, or I don't like being here. It's actually got nothing to do with what I like or don't like about, say, a particular health behavior like problematic substance use. Often what has been shown as a mechanism as well in that kind of research around MI brought into an initial assessment is better disclosure, more kind of information to be able to effectively then respond, and a greater sharing of priorities. And that both services, workers, and clients were feeling much more connected on the same page. Really curiously, as I sort of started exploring this a little bit more as well, I found some really recent stuff happening, and still actually in the process of happening, where Margot Herlocker, who is the principal author here on this particular paper, who interestingly enough is part of University of New Mexico. And for anyone who is MI kind of aware, New Mexico, or University of New Mexico, is where Professor Bill Miller, one of the founders of MI, currently kind of is housed. So not surprising that in New Mexico, they're doing a lot of work around this, that they're really looking at a bit of a process there to look at change management in their clinics to actually replace initial assessment with an MI interview. So this was a bit of the, I guess, the precursor or the preliminary work on this as part of a change management strategy to find out, well, what did current clinicians, what were their perceptions? And everything that we spoke about there earlier around doing more of and doing less of that came out from the different research was reflected from this particular analysis as well, that the current approach of assessment first felt very long, bureaucratic, and disengaging for workers and for clients, and the relationship or engagement first was what was desired. So that's kind of a little bit of the, well, why is MI a good companion? Where are we at with our current sort of assessment processes as reflected through the literature? You might have amazing assessment approaches where you're at. Would love to kind of hear about that as well. Or you might be also experiencing some of the challenges that we've started to see come up through the findings that we've shared this morning. So now I want to talk about the how. Well, if we're going to bring MI to initial assessment, what does that kind of look like? And MI is really based on two skill sets, and you can't have one without the other. The relationship skill set and the technical skill set. Both are incredibly important. So what does that mean in terms of relationship skill set? Again, I know that there'll be many people out there who are well versed in these things, but one of the core things about motivational interviewing is that it's not just a set of skills or a bag of tools. It actually really begins with this idea of the spirit of MI. Think back to what we were talking about before about what MI has brought to the AOD treatment world since kind of like the 80s and the early 90s when the first edition of the MI text came out. The spirit of MI is all about partnership with the people that we're working with and coming with this stance and approach. And let's not underestimate this. I've been around in this field for a number of years, and I've seen that shift from the treatment world being about kind of almost kind of a stance of dominance and hierarchy in terms of where, kind of the services were or the worker was in relation to the client, to actually really changing that whole kind of dynamic in a way that we're actually kind of, a guest in the person's world, that we both have expertise, that this is a shared process. The understanding of ambivalence and the language of change, which again, don't have a huge amount of time to go into, that's really helped to accept that change is difficult and that it's a person's job to come to our services in two minds, because their experience has been the substance has worked, and also maybe now they're here because it's not working, but both are still true in that kind of dialectic. And MI helps us with the spirit to kind of just really meet people where they're at with that. Also brings compassion, that we're here to kind of like look after or the client's well-being, and particularly empowerment, that this is a co-designed agenda. We're co-setting the focus of work in MI. And this little kind of, graphic here is really identifying, I think, in many ways, the ambivalent stance, or why PACE is so important, because people come to us kind of, in between this kind of experience of, wanting to kind of change, but also then wanting to kind of like, maintain the status quo as well. This is normal, this is natural, it's not pathological. So MI brings that stance. And often we use that in treatment approaches. I guess I wanted to focus a little bit more, as you've already heard, on how do we make sure that that's woven into what we do as part of our initial assessments, because sometimes many of us don't have ways of changing everything about that, or it might be incremental that we change things over time, but can we maybe adapt our practices to support some of these principles? Second part of the relationship skills, or the relational skills of MI, that I just wanted to briefly mention is the 4 tasks. And I think this is what MI really, really, really brings in such a strong way to our ability to make our front door a whole lot more effective and welcoming for the people who come to our services. It really focuses, the 4 tasks of MI this is what a worker is kind of doing in many ways in MI. First part of this step is to always ensure engaging. Second step is focusing in many ways. What is important to the person? Third step is then evoking, spending some time getting a person talking about that kind of inner, two-mindedness, putting it into words and articulating it, so that in particular, that side that is desiring the change, that can be given breath. It can be allowed to breathe, and the person can be able to talk about that. That, as we know from the research, that type of talk helps to support greater likelihood that change occurs, as well as also planning. And I think all of these steps are things that we can do in our MI, integrated AOD initial assessment. So I suppose what I'm really talking about here, and I'll show you a bit of a graphic in a moment to kind of bring those 2 points together, if I'm not making too much sense at the moment, is that maybe we can't change the form at the moment, or the form being either literally, a form, or it being the way that we currently have as our service structure that we do these processes. But I'd suggest the companionship of MI with that really helps us to create a different feel. And many of you might be already kind of doing these types of things. So now I'm going to talk about the relationship, the relational skills we spoke about, bringing the spirit through PACE, making sure that we are attending to those kind of 4 tasks, and that we're doing that in a way that helps us to build that engagement first before we kind of step into other areas. So how do we do that as well? What are the technical skills at MI? And this is going to be like a blindingly, blisteringly quick overview of these things. And then I'm going to give you a whole lot of slides that give suggestions. So if any of it is useful, because we're not going to get time to go through it all, please make sure that I know the link probably to the slides would have been shared already. If it hasn't, or if you've missed it, just ask for it again so you can look at these things afterwards if you think there's any value. So same form, different feel. In the left-hand column there, this is from me. There's no research on this, so it's just it's my personal reflections and ideas that I'm wanting to share with you. Over on the left there, some of the things that we're generally trying to cover off in that kind of initial engagement and an assessment, whether it be 1 session or more than 1 session. The purpose of why it is that we're doing it, and there's usually very good reasons about why we're wanting to kind of cover off on those elements. But what I'd like us to think about and maybe spend a few moments reflecting on is, often we're going into those processes thinking about, I'm here to do an assessment. I need to gather information because I need that information to be able to, decide on or work on whatever the next steps might be. That's I've been there. That's me. That's been me, and that's historically for sure. What I'd like us to think about, if we're really wanting to interweave and integrate MI, is to think about, no, that might kind of be the end product. But what our role is to go with the spirit, because my first task here is to engage with the person. That's what I'm doing in this initial assessment, is I'm engaging, not just me as the worker, but with the relationship, what I represent, which is the service. But another part of my role in this is to focus. It's like, what's important here? What's the person wanting to look at? What is it that maybe is a limitation on what we can do or what we can't do as a service, so that we can focus that together? And that we know that the language of change helps people to, follow through with their, or more likely result in people following through with making changes that they desire. So how can I actually use this process to help a person evoke not only what's important to them, but a little bit about why, what are the desires, what are the wishes, what are the hopes that this person has? Often we're gathering information for our purposes, as opposed to that idea of a person being able to kind of really clarify and determine and articulate and conceptualize, well, what is their hope? And how is it with the planning that they might be able to get there, or at least take the first step? So that's just a little bit of how I'd like to proceed now, for the next kind of 10 minutes or so, is to really reflect on, that's an approach that we bring, or a stance that we bring. I'm not just doing an assessment here. I'm engaging, I'm focusing, I'm wanting to evoke all of these things that we know help, things like change, as well as all those other things that we'd want as a byproduct: engagement, retention, all of those sorts of things. So, same form, different feel. Remember what we're trying to change about the current process, moving from what's on the left over to what's on the right. MI brings us two key skill sets. Again, not enough time to go into all of these now, but how do we actually do the engaging and the focusing and evoking and the planning in MI? Well, we use what are fairly standard things that aren't owned by MI, but have been tweaked by MI to make sure that what we're focusing on is hearing from the client about things like their reasons, their needs, their desires, their thoughts, their commitments, and their kind of their capabilities and abilities and those sorts of things. And we use those micro skills, which are used in a lot of therapeutic approaches. Just in MI, they're kind of focused and directional towards wanting to hear more of the change talk. So open questions, affirmations, reflections, summaries. Because of our short time today, I'm actually going to give you examples of most of those, more sort of open questions, affirmations, and summaries. Reflections would take a little bit longer to do justice to, but to give some examples of how we can weave that into the same form to create a different feel. The other one is the language of change, which I've already mentioned. I'm hoping that by adding a few things, or considering a few small things that won't take a lot of time, that we might be actually promoting that greater expression or ratio of change talk, which we know the differential between those two, change and sustain, is what contributes to good outcomes. So at the front doors, there's different ways that we can do this. We can weave it into initial assessment, same form, different feel. We could do our normal assessment and then kind of throw in brief interventions and MI afterwards. That also has a good evidence base. I'm really focusing on that first one there. How do we kind of like maybe consider what we already do, given that we may or may not have the power to change things wholesalely, or burn some things down, but how do we kind of work within existing processes, again, to achieve these types of focuses and these types of kind of tasks with our clients. So in this first engaging stage, I'm sure you have all really good ways of doing that, where we're welcoming, we're often wanting to make sure people understand things like consent, we're wanting to ensure that we're building connection, we're all well-intentioned, we're often time poor. I'm just going to throw up a couple of, like I said, this is more for probably later on to go back and reflect on, if you think any of this might be useful or valuable for where you work and your services. is just ways that open questions can just add a lot of richness to this part where we're focused on. I'm not just here to do assessment at this point. It's engagement first, assessment follows in many ways. Well, probably even after focusing that in that kind of stepped way. So a couple of questions there, a way that we could kind of ask people to really be collaborative, to be bringing the spirit in terms of partnership and empowerment and compassion. Again, for many of you who know motivational interviewing, affirmations so important at this stage. We use them in MI for a lot of reasons, to help build rapport, but also to help build confidence as well in people, because that's such a big factor of change. I can have all the motivation in the world to change something, all the reasons to change something, but if my confidence is lacking, then that's going to be something that always kind of gets in the way. So using affirmations at this point, these ORs. Now, I wanted to just very briefly talk about a framework of offering information. We often are giving a lot of information straight up in processes, things like, limits of confidentiality, duty of care, fairly kind of standard stuff, important elements to the work we do. Just wanted to show you, again, rather than tell you, that approach of ask, offer, ask, the design of this is very much about when we're sharing information to reduce the likelihood of defensiveness, or where people are feeling like they're being told something that they already know, which often, I don't know about you, but that often sees me kind of shut down a little bit, is to use this type of framework that MI promotes. It's been called different things over the years. It's been called elicit, provide, elicit. You might have learned it in different ways. Okay, would it be, again, bringing the spirit, bringing the engagement, asking these open questions? Would it be okay to tell you how today's going to work? Let's kind of start with what we're going to do is start with what matters to you. They've all covered other questions that we ask everyone. Sorry, there's a bit of a typo there. We can pause, of course. How's that plan sound to you? Just moving through in the interest of time, there's also other important things that we often want to share with people. Things like, as I mentioned before, the limits of confidentiality. In an MI way, and an MI consistent way, we can ask people what they already know about that first, and then just fill in the blanks. And then follow up by that kind of second ask. A lot of this you may already be doing. It kind of doesn't, it's not rocket science in a way, but if you think about what we're trying to do here, engage with people to bring the spirit. This is often a way where people are bought into the process. They're not just passive recipients. We're actually developing that partnership, that collaboration. We're finding out what they know early on in the session. Some other examples there, we might be using some standard screening tools to be able to introduce those, why we ask these questions, even in our assessment, so that we can kind of share that information and invite people to tell us what their knowledge is or what it is that they think about these things. Just nice little ways. Also to support things like cultural protocols and cultural responsive practice, to try and, in every effort, make things culturally safe for the people who attend our services. Ways that we can do that using this type of framework. Ask, offer, ask is really a way of helping information land so that it's heard, that permission's been given, that it's been invited in, that as long as it's kind of probably less than 60 seconds of information that we're giving when we're offering it, that's usually going to be heard more likely. So just a way that we can bring that in very upfront. Presenting concerns, that's fairly normal. Why someone come? Not just accepting what's on a referral, but asking people. So we're in the focusing stage now. Again, asking those kind of very maximally open questions to move beyond maybe just what it is that we think it is, or that might be, again, written on some other piece of paper that's come to us, just to start exploring. And in many ways, we're not just focusing here to co-set the agenda, to collaborate with the client as a consultant on what's our focus going to be. We're also probably getting a bit of assessment information with these types of approaches as well, to get a bit of an idea of where our direction is and what would be helpful. Again, I'm just going to share some examples here of affirmations. and summaries. I just mentioned these. We often use them at the end of treatment. I would say, or end of a session. I would say, no, do it a little bit more often. You know, actually kind of reflect back some of those little nuggets, those little embers, those kind of moments of gold about why it is that people are looking for things to be different, whether it be about what would be better about change or the things that I don't like about the current situation. Every 5 to 10 minutes is what's recommended, just 20 or 30 seconds. Hearing that back helps with engagement, helps with focusing, helps also, as we'll see, with the next step, which is evoking. I just put this slide in there. I heard about this at the Minto Forum. Really kind of, it's a Scottish movement that really pretty much really supplies the first question to develop a co-designed agenda. Yeah, what really matters to you at the moment? Sometimes, I don't know about you, but we can get really kind of stuck or held hostage to the idea that there's a lot of complexity in our clients and things like that, and that we're kind of, you know, and that is true. But sometimes there's very simple things that they're looking to work on. We don't have to look at kind of the whole, you know, trying to address the whole, all the issues, but what's the next best step as kind of co-designed by the client in relation to what we can provide and or where it is that we might need to get that if that's not within our scope. Risk and safety. I'm going to go through these fairly quickly because I want to leave enough time for questions. Again, stuff that we standardly need to do. Sometimes the questions are a little bit blunt. I'm thinking back to the AOD's 16 page, and I saw a few comments in the chat that people do recall that. I'm not the only one. Sorry about that reminder. But yeah, how we can rather ask, you know, have you ever attempted suicide? You know, things where we might be able to kind of, again, introduce these topics, engage, focus what a person wants to kind of, you know, bring, tell us about where it is that they might see that there is risk, or where we can kind of inquire about that in a curious and gentle and person-centered way. Again, we might hear some things that give us concern around things like maybe, you know, combinations of substance use and medication, or I've also put the fairly common one that comes up again around wanting to ensure that people are practicing safely with when they're injecting substances and other drugs. So just again, ways that offer ask can just change that whole dynamic about you know, uninvited or unsolicited information being shared in a way that doesn't necessarily land. How can we do that more together by asking permission, asking what a person already knows, so that we're not duplicating information where they've been told this 100 times before, because often their experience with healthcare is to get the terrible, horrible things lecture about what it is that they're doing. So again, just some couple of examples there, which if it's useful for you to go back and revisit, I won't go into detail now. Substance patterns and functions. Open questions to explore. I know the standard kind of drug use history, what have you used, when did you start using it? And, you know, there's important information there. Is it as important sometimes as the value and the time we spend on it? Because I would suggest, particularly with the types of things that we've got reflected here as open questions to explore this topic, is to explore the functions, not just the quantities. Not just for our benefit, but also for the client to be really expressing and evoking and sharing some of that information that's probably part of the story as to why they're looking for change or have a desire and a want and a wish for change. It helps to kind of bring that forward. That, as we know in MI, is kind of really strong connection then for the person to build that relationship with those reasons for self-motivation and for seeking to do things differently. So in this, and this is where MI and the spirit and the understanding of ambivalence and the language of change just comes into its own, because it recognizes that there is two sides to this, and we'll often be hearing both sides. I've just put up here, I said I wouldn't spend a lot of time on reflections, but I just wanted to really give a shout out to the power of double-sided reflections, which if you've not done any MI training, I would encourage you to do. But they're just simple kind of statements where we reflect back both sides of the ambivalence in a bit of a strategic way, where we represent the sustained talk first. We used and instead of but to join the two together so that we're not erasing, we're actually acknowledging this is your truth. This is your experience. We're valuing the sustained talk, but we're kind of then ending with the sustained talk, the change talk. in the hopes and the interest that the person will continue that paragraph talking about the reasons for change. Again, a lot of you will know this. If that's new to you, I'll show you some resources at the end where you can go and learn more about it. But I think this is where one of the ways it really brings in its value for AOD initial assessment is that we can hear both sides. We're not trying to shut down one. We're actually valuing and acknowledging, because this is the client's experience, to be able to kind of handle both sides of that information. I do need to move on. Co-occurring health, like there's a big list in these next couple of open questions, rather than, do you have any medical diagnoses, what medications you're on, and all these sorts of things. The way that we ask questions now, which is more that kind of checklist interrogative, even if we don't intend it to be, it's often what clients we're seeing through the research are feeling. It's important information, but are there other ways that we can evoke that type of information, that we can actually be evoking things that the client wants to tell us, which again brings them into the partnership here in a much more kind of collaborative way than necessarily us just getting what we need. And there's a couple of examples there. There could be pages of these. I've just kind of put together a couple that I thought might be useful, that I've used at different times. Being able, again, we're evoking here, but in some ways we're also focusing when we ask these sort of questions. Affirmations are important, particularly when people are talking about things that are not great or not amazing at this point in the kind of part of the assessment process, just reminding people that these things take courage, examples there, that they're obviously really interested in themselves, that they're noticing things, and summaries again about what's important to your health. Using that approach base instead of like you've got this list of problems. It's like what's important here is that you have more energy, that you have more ability to kind of get up and get into life and to do the things that you want to do. You want to be able to make sure that you're able to kind of sustain your well-being, to be around for the kids. That kind of approach goal, as opposed to necessarily addressing the deficit side of things. Psychosocial context, there's a lot of things and domains that fit into this, but ways, again, suggestions, grab the printout if there are any of these that you want to go through, add your own, really kind of a bit of a mixed bag of what I've put up there. But, asking about supports and strengths, who's in your corner right now? Who else would you like to have in your corner? What roles matter to you most at the moment? I know that we've often done in our kind of standardized assessments, we're looking for a lot of information. I think in many ways, these sorts of processes, they don't slow us down, they actually make it faster to really be able to get a picture of what's going on from an assessment point of view, as well as to help the engagement side, where clients are feeling like they're a part, that their hopes are really kind of at the top of the agenda. Formulations, follow-up planning. I really think also what an MI integration with initial assessment brings, because of that stage or that task of planning, that we're not just there to gather information and then tell the person that we'll take that to a meeting and then we'll let them know what's going to happen, what we think will happen, that we actually are moving into planning as well if we're following through on those tasks. Not like what the whole plan is or everything, but what's going to happen between now and when we get in contact with you, particularly if there's a bit of a wait for that. So what's most important for you? What's the next step here? What's going to happen? What could I help you with? What information do you need beyond just like waiting for a call as to when you'll get an appointment? If things start to wobble between now and when we can see you, what's that look like for you? How would you know? What would your first response be? To actually just evoke those types of things as part of steps that help people feel like that they have got some, some ideas and strategies, or had things reinforced, particularly by somebody, from that kind of in a bit of a power relationship there, or a power position of having some specialty and expertise. So just again, affirmations are so important here. Making sure, again, that if we're offering information, the ask, offer, ask is so important here, that we're not just giving unsolicited advice, that, we're asking if we can share some ideas, offering it, asking back what a person thinks, all those types of strategies. Again, to really make sure that whilst we're doing assessment, our aim is not to complete an assessment. is what I would encourage us to start to think about. If we're going to integrate MI approaches and frameworks, that we're engaging, we're focusing and evoking and planning within that period of time. That one session, that short interaction, that 2 sessions, whatever it might be. Interestingly, Margot Herlocker, again in New Mexico, they're actually, this is a feasibility kind of statement around a protocol to introduce to all the clinics in New Mexico, the AOD clinics, this kind of replacement of traditional assessment with an MI interview, which is a little bit of a step further about than what we've spoken about today. That's yet to come. But the nice thing is this work is being done, I hope, to start to build a bit of a critical mass to identify how we can do this better. Some next steps for us, if you're interested, I've mentioned about downloading the presentation. That's a resource, I hope. I just encourage anyone, you might even be starting to have done it through our chat this morning, is to look at your existing form, to start to think about, well, where's a relational skill? Where can I bring the pace in this form or in this process? Where can I bring the 4 tasks? What's a technical skill I could start to use more often? Is there places I could ask some of these maximally open questions or offer affirmations or get into a pattern of at least every 10 minutes doing a 20 to 30 sort of second summary, particularly pulling out the things that relate to a person's wishes, desires, hopes, goals, and their reasons for change. And then to think about, next time I go into one of these, how can I do that so that what we're achieving is the same form, different feel. If anyone wants to go into any of those papers that are mentioned up there, or the research, particularly on things like how we're doing initial assessment, the references are all there. And many of you may know that we have a rather large e-learning, online e-learning suite, all free and accessible. And we actually have 4 modules, if you didn't know, on this topic of motivational interviewing, not necessarily about integrating it with assessment, but more on the kind of the relational and the technical skills that you may want to look at. And I just wanted to give a plug in my last minute here or so around another good human I met at the Minto Forum, Mark Powell, who works in Victoria in a residential program down there. He's coming and generously offering his time next week to speak about how he's really integrated the spirit of MI and the MI approach in the work with families down there, families of people impacted by substance use. So thank you very much for letting me talk. Julia.
Thank you, James.
Sorry, I didn't realise it would take time. I'm happy to hang around for a few minutes, but if anyone else needs to go, I fully understand. It is coming up 11.
Oh, good. There's a couple of questions here, so we'll go through them really quickly. I just want to say, brilliant presentation. This is why I love MI. So good. So here we go. In your experience, what are the biggest differences between a traditional assessment and an MI-informed assessment?
Yeah, I think it's, without sounding too kind of wild and woolly, I think it's the stance we bring about what we're actually trying to achieve. If I was to say it in one, it's the spirit that I'm going in there to understand. You know, my checklist is not the information gathering, it's that we're engaging and focusing on what's important and evoking some of that for the client, and maybe coming to a very small next step plan. To answer that simply, I could talk about that forever, but that would be the main difference, I think.
We'll do that later.
Same form, different feel. I've said it a few times by using that stance. Yeah.
Okay, so you talk about the spirit of MI, which is PACE, partnership, acceptance, compassion, and empowerment. Which of these do you find practitioners struggle with the most and why?
Yeah, look, that's really interesting because it's again, it's one of those almost attitudinal approach things, and I don't think necessarily we struggle with any of them in a conceptual sense. I think we all agree this brings person-centered practice. This brings trauma-informed care. This brings culturally safe practice. It pulls it all together. Gender affirming, all of that. These types of attitudes and approaches are common throughout all those threads, and we're all pulling together in that way. I don't think they're necessarily difficult. We're up against barriers though, against things like time and kind of like workloads. So I don't think I've not really met anyone who doesn't have at their heart to bring the spirit or any of those elements of the pace. It's more the kind of those other barriers that get in the way, which I don't necessarily have the answers to in today to be
Yeah.
able to talk about. But I guess what I'm wanting to focus on is that barrier of the high attrition rate in that early stages, and can we do something to do that better? And even if we're asking a few extra things or asking them differently, slow could be very fast here, and that's an MI phrase from the founders. That taking those little extra moments can really help achieve outcomes. So I don't know if I've answered that fully. Uh, if anything, I know
You
myself.
answered it well.
Well, I can't speak on anyone else's behalf, but in me, it's always reminding myself that, particularly when I see people in distress or quality of life affected, is to kind of really be accepting that people have good reasons both ways for doing what they're doing and maybe wanting change, and equally valuing those. Yeah, that's one I know I always need to work on rather than wanting to kind of fix it. Yeah.
Yeah, thank you. There's one that's just come through, and she's thanking you. And she says, I'm really interested in the affirmation part you mentioned. My question is how to do affirmation more effectively to help build confidence. And she's given a little bit of context here. She said, sometimes I run out of words and keep repeating, such as, it is hard, you're doing great.
Yeah.
I feel it is vague and does not effectively build rapport with the clients.
Yeah, no. Really good point. And if you're in Queensland at all, please come along to one of our using motivational interviewing and AOD workshops, a 2-day workshop, or jump online. I'm going to give you a very, and for all our MI trainers out there who, if anyone's listening in, I apologize in advance for giving probably a very simplistic approach to this. Affirmations in MI, they talk about simple and complex MIs, affirmations. So simple is an achievement, something someone's done or achieved or whatever, even if it's effort, to affirm that. And a complex affirmation is then trait or characteristic that people have. Things like perseverance, things like kind of the ability to kind of, step up, move on, and, keep going, to affirm those. Here's a little kind of MI, hack's not the right word, MI tip or skill. It's called mining for affirmations. In MI, I haven't said it, but in MI, it is so important about where the language of change or the talk is coming from. It needs to be coming from the client's mouth in many ways. Same with affirmations. This mining for affirmations is where we just ask an open question around something. Hey, you got here today, on time. You've been here on time for a number of weeks. How do you do that? And let the person talk about the strengths, the skills, the abilities, the traits, the characteristics, the achievements, whatever it might be. And then we just kind of do a little affirmation of their language. Quite powerful to point those things out and to get the person to be able to, it's in that school of evoking that we're actually asking open questions for a person to give us the language, as opposed to us saying, hey, you've got a lot of perseverance. And they're kind of going, no, I don't. It's kind of like saying, how do you keep showing up? And they might say, yeah, well, I've just got to do stuff. I got, that's what I learned, or something like that. So that would be my little very quick, what we normally spend half an hour in a workshop talking about.
Perfect. We just had another one. When I'm doing AOD assessments, if the person I'm working with talks about shame and guilt, I pause, then say, I give you permission to lose the shame and guilt. Because when we feel that, what do we want to do? Pick up, use. So, yeah, I guess it's not a question, it's just their own affirmation of what they do.
Yeah. No, that's
really
good.
We do have
I guess that's coming up about 5 or 6 past, so people will need to go. I'm happy to kind of hang around if there's 1 or 2 more, but if there's anything,
I'll give you a last one. How's that sound? I'll give you a last question to answer. What are the common barriers for services trying to embed MI at the front door of care?
Yeah, look, again, probably the ones I maybe mentioned before. Again, well, it's it's a number of things. Often are the way that we have kind of standardized assessment processes, and some of that is informed by things like, you know, national minimum data sets, really important for funding. So, you know, we can't kind of lose that. It's part of the systems that we work in. So they're often kind of very kind of closed question type interrogative processes, not intended to be that way. And people can bring a lot of warmth to that. I'm not saying that, but the actual kind of design of things is often about that we need to get all this information to be able to accurately formulate risk or, you know, treatment, as opposed to kind of like using the client as a consultant really around those types of issues and evoking and focusing with them. So that's probably one thing. Again, it's time and things like that, believing that we don't have time to kind of add anything more. I would just say this can be integrated as opposed to adding time in a way, particularly when we see the good outcomes. And people are busy. People are busy. You know, services are underfunded. We're all short-staffed. So there's those sort of census type issues, and being over census is also part of the story. So I wouldn't say, you know, none of this is about changing everything what you do now, but are there little ways? I encourage people to reflect and maybe have conversations with like-minded people. Are there little ways that some of these elements could be brought in? Because I think once you do them once or twice, you start to see what happens, what you hear, you know, kind of the feel of the look and the feel of things, and that encourages us to do them more. Yeah.
Yeah, brilliant. Thank you.
And there's lots of free training on MI if you want to kind of really brush up on your skills. Some of it from us, but we're not the only kind of keepers of that as well.
Okay, then.
Well, and just before we kind of go, for those who are remaining, I just wanted to also acknowledge my colleague Julia. This is the first webinar that she has hosted and facilitated. So it's always good to work with you, Julia, and you've done a bang up job.
Likewise. Thank you. Thank you. And for everyone that's left, my passion for MI is because of this man sitting here today. I've seen it work. He does MI on me and thinks I don't know what he's doing, but I do know what he's doing. And it has worked with me. I was a smoker for 50 years and I stopped smoking 5 months ago.
And that's all on you, Julia. That's all on you. So well done.
You were very kind.
Good. Thank you, everyone.
Thank you. Thank you, James. Thanks to everyone for attending today. We hope you enjoyed it. These slides and video will be available on YouTube over the coming days. So if you did have concerns with the links, there were a few people who had concerns. They will become available. So we hope you enjoyed it, and we look forward to seeing you same bat time, same bat channel next week.